and gentlemen, we are all set to invite our next speaker, ladies and gentlemen, here on the stage. She is a well-recognized doctor with over 20 years of experience in the field of regenerative medicine. She is recently awarded the Presidential Award presented by Society for Anti-Aging, Aesthetic and Regenerative Medicine, Malaysia. Well, we all really enjoyed the session that she gave yesterday. Please put your hands together, ladies and gentlemen. I would like to do the honor to invite Dr. Sunita Kaur Ahluwalia, ladies and gentlemen, here on the stage with us.
Hi, good afternoon, everyone. My name is Dr. Sunita. We'll make this as fast as possible. Today, we are going to speak on bioidentical hormones, not the numbers that you need, is why you need the bioidentical hormones. These bioidentical hormones are here because of your quality of life. We are not talking about reproduction levels, we are talking about quality of life, okay? So what is a hormone? Hormone is actually a chemical messenger that helps your body, it tells your body what to do. A chemical messenger is a hormone that is released by the brain to tell each and every organ in your body what to do. That is what we are trying to address. We are trying to address the chemical messenger deficiency that we have so that we have got quality of life. Now, when we speak about hormones, we are not speaking about the quantity of the hormones. We are speaking about the balancing of the hormones. Hormones is all about balancing. Please don't think that you can go to a lab, do a hormone test, you have a deficiency, and you just give the patient all the supplements you need to increase. It doesn't work that way. In hormone therapy, it is a very fine line that you walk. It is all about balancing. The problem is no one tells us about the imbalance that you have in hormone therapy. Okay? Now, that's why I'm here to tell you what exactly is a hormone imbalance. We all have this. We have seen this. We have gone through it. We have friends who have this. People who show up with fibroids, people who show up with mood swings, patients who have got PMS, patients who come with ovarian cysts. They are subtle, very subtle signs and symptoms that you find in the society. Headaches, acne, hirsutism, hot flushes, changes in your breast size, changes in your libido, your foggy thinking. This is a hormone imbalance. It is not that you need hormones in a quantity. You need to balance the number of hormones that you have. PCOS is something that we see very regularly. Okay? Most of the time, most of the teenagers will show up with heavy menses or it will show up with excessive body hair. We do the scans, we do the tests, it looks normal, it's all within normal range, and nobody does anything. Give it 5 years from then, you will end up with fibroids, you will end up with a hysterectomy, okay? This is what I'm trying to point out to all of you, that subtle changes need to be addressed, right? So now what happens if your hormones do not behave the way they do? Give it time, you will end up with a disease. We call it a disease, right? Right from anxiety problems to palpitation problems to weight gain to thinning of your bones or osteoporosis. These are all hormone-related issues. Look around you, we all have different shapes and sizes, me including, right? It is all about your hormones. We have the same DNA, we eat the same food, maybe not the same quantity, but we are all of different shapes and sizes. Why? It is your metabolic rate. It is your metabolism. It is how you digest your food. It is how your brain tells your organs how to use the food which has been digested. Hence, we are all different in shapes and sizes because of the hormones that are dominant in our body. We all have the same hormones, be it a male, a female, we all have the same hormones. All we do is we have different quantities in every stage of life, okay? That's what I'm trying to tell you. We all have got the same hormones. We are not talking about reproductive therapy. We are not talking about reproduction. We are talking about hormones which help you to sustain your life and sustain the quality of your life. You need hormones for bone density, you need hormones for your brain, and you need hormones for your heart. That's what we are trying to do. We are trying to balance the hormones. Now, once you know that in every stage of life, we will grow old, as how nature wants us to go through. We go through a stage called menopause. Now, in menopause, it is not about hormone imbalance anymore. It is about the lack of hormones. Here, when your ovaries start to shut down, the amount of estrogen and progesterone and testosterone and all the other hormones in your body will slowly decline. And once this hormone declines, the body will tell you that you have got an insufficient amount of hormones. Here you will come and seek for a doctor. Why? Because you have got some problems. You've either got a fracture, or you have got insomnia, you can't sleep, you've got mood swings, you've got joint aches. That is the most common reason why patients look for an orthopedic surgeon, is because we've got knee problems, we've got hip problems, we've got joint problems. Why? The cartilage is wearing out. Why is the cartilage wearing out? You do not have the estrogen, progesterone, and testosterone to lubricate that cartilage. That's what we are trying to do, okay? We are trying to get you out of the imbalances by balancing the hormones. So postmenopausal, it is about optimization of your hormones, just enough to keep you healthy, to optimize the levels so that you have a quality of life. Premenopausal, it's about an imbalance that you have, that we are trying to balance the estrogen, progesterone, testosterone hormones so that you do not have a disease. These are the hormones which we are talking about. It starts with cholesterol, all of us have that, and it goes on to make your progesterone, your DHEA, your estrogen, your testosterone. These are the hormones which we call sex hormones, which we go on to replace for quality of life. Some of you will tell me, if I don't take hormones, what happens? Nothing happens. We all grow old. We all grow old gracefully, as how nature wants us to, but we will end up with a problem. We will become slower, we'll sit in the chair, we won't have the energy levels. And that's what I'm trying to tell all of you, is that we want the quality of life in our golden years, right? So when we say hormones, now how do we replace these hormones? Replacement of hormones is always with bioidentical form. Why bioidentical form? Because it is plant-based and the structure of the plant is altered to mimic the structure that is in your body. So your body will perceive this hormone to be natural, to be 100% from yourself, that it goes on to repair the tissues and you come out of all the diseases. It is about quality of life. That's all it's about. Replacement of hormones for the quality of life. It is the control and refine replacement of hormone therapy so that you do not have a disease. Okay? Patients will ask me, hormones cause cancer. I agree, 100%. Hormones do cause cancer, but it is not the hormone per se, it is the imbalance of the hormone that causes cancer. That is why it is so important to balance your hormones so that you do not have a disease. When we touch menopause, it is about the driving force of health. You want to sustain the quality of life as much as possible, as long as possible, until God decides when is your time, right? So it's about hormone balancing. You need to rebalance your hormones so that you are able to rebalance your life. You have a choice. We will all be old one day, but we want the quality of life where we are as active as we were when we were younger. We can do whatever it takes, food, spas, but it won't work. You will need your hormones. You can turn 80, The choice is yours. Whichever way you want to turn 80, you can turn 80 gracefully or you can turn 80 with the help of hormones.
You can't keep getting your levels checked and to check if there's an imbalance. And either tofu's got a bad name or there is some sort of misinformation about it. But how much tofu or edamame or any of these plant-based estrogen foods are okay to consume?
Okay, there's a very big difference between plant foods and bioidentical hormones. Okay, bioidentical hormones are structured to look like the exact hormone molecule in your body. Hence, if I supplement your hormones with bioidentical hormones, when we do a blood test, we see the difference on the blood test. Progesterone, if we start when you are menopausal, you'll be 0. When I substitute it in your body, 3 months down the line, it will show a difference. That's why stick to bioidentical hormones, because you can be monitored. Okay? If you use plant-based tofu, if you use synthetic hormones, your Primarine, your OCPs, whatever else hormones, they will not show up on your blood test. That's what I'm trying to tell you. Take the path which can be monitored very safely. Bioidentical hormones are structured in such a way that your body perceives it to be natural and it shows up on your blood test. Okay? So when you do something trying to replace, we need to make sure we are within that normal range or we are within that range which makes you optimized but still healthy.
What's the difference between HRT and bioidentical?
HRT is not bioidentical, meaning the structure of the molecule is not the exact structure in your body. If the structure of the molecule is not natural, like in your body cannot digest that molecule. So, if you take a tablet of paracetamol, right, we don't have the enzymes to break down paracetamol. It gets stuck. Somewhere along the way, it will cause a side effect. You take synthetic hormones, I'm not saying it's bad, we had it, that's all we had at one point of time, but we have better ones now, which can be monitored. If you do synthetic estrogen, it's not going to show up on your blood test. You don't know where you are. You don't know which level you are. You don't know whether you're too high, too low. And by the time you find out, you have already hit a disease. Okay? Cancers especially. So stick to something which can be monitored easily, cheaply, and that's the bioidentical hormones. I've been on bioidentical hormones for the last 20 years. Okay? I hit menopause 15 years ago because of endometriosis, and I've been on it for 20 years. Without bioidentical hormones, I won't be standing here today. I'll be in hospital somewhere. No, I'm from Kuala Lumpur. I'm from Malaysia. Yeah, but you have many doctors in the audience. Dr. Lenny is there, Dr. Sanjay is there, who do bioidentical hormone therapy. You can always consult with them.
With that, thank you so much, Doctor. Everybody, please put your hands together for the lady.
Thank you.